I would like to welcome you to the presentation, Acupressure for Induction of Labor, session 11, which is going to be spoken about by Lordana Zordan. And I would like to take this opportunity to welcome Lordana to the presentation, but I would like you, first of all, to know who Lordana is. Lordana is a midwife acupuncturist and author of a book called Acupressure and Moxibustion for Childbirth, published on Amazon in 2024. The book is published in Italian and Spanish. She is an independent midwife and midwifery teacher with a BSc and a master's degree in midwifery from King's College and City University of London, respectively. She's a certified acupuncturist and specialized in obstetric acupuncture. She is a strong advocate for acupressure internationally, as it will allow midwives to expand their role, becoming more complete and independent practitioners. She teaches nationally and internationally in workshops for midwives on the use of acupressure for pregnancy and childbirth. So with this information, I would like to welcome Lordana to give us her presentation. And please, if you have any questions, please keep them on the chat so that I can take note of them and bring them to the attention of Lordana later on after the presentation. Thank you and most welcome. Lordana, you are welcome.
Okay. I just would like to teach. Sorry, I'm just going to open the computer screen. Okay. First of all, I would like to thank all the volunteers that made it happen at this event and that allow me to share my knowledge on acupressure to midwives all over the world. So thank you very much for your commitment, all of you. Okay. Okay. Well, we're talking about acupressure for industrial labor. Basically, acupressure is the industrial labor is increasing worldwide, and acupressure with holistic approach to care offer a potential opportunity to reduce the medicalisation of childbirth, enhance women's choice about place of birth. When I'm talking about holistic approach of care, I mean the traditional Chinese medicine, seeing the woman like not only her body, but the mind and the spirit is all connected. And when we want to help her to feel better, we need to consider that. What is very important about acupressure, the practice midwife will allow midwives to provide better care to women, enabling them to experience a safer, more natural childbirth. Nowadays, a lot of women would like to avoid using drugs because they have a lot of side effects, and they want to have a more choice, have a natural childbirth, avoid medication. First of all, I need to talk about acupressure is a part of a Chinese medicine, which is ancient, about traditional, 3,000 years old. And in order to introduce acupressure, I need to tell what is Qi and what is meridian, just the basic principle of Chinese medicine. Qi. What is Qi? It's an energy. Qi can be translated as the energy of life force. It's an energetic form that you cannot see, but is quite powerful. Yes, you can see as the power of lifting the lid of the pot. Qi flow into the channel like a we can call channel or meridian, which I think are like a river, which are like a network of rivers that travel our entire body and connect to our main organs. To consider the Qi is important, we need to see that the Qi can be deficiency or can be stagnation. If we got Qi deficiency, just to connect with the labor, labor just doesn't start, it's low. In a way, it doesn't the woman doesn't have the energy to have a good labor. The labor tend to be very long. However, if the Qi gets stuck, like we call like Qi stagnation, Chinese medicine, into the meridian, women will feel like the labor doesn't start because there is no, women are very anxious, very irritable, And because of that, the labor doesn't seem to start. So need to think about two considerations, can be Chi deficiency or Chi stagnation. And then, as I say, talk about meridian. Meridian are in good health. Chi moves smoothly to the channel. However, if there is a blockage or blockage that the women will feel more pain, for instance. The meridian are responsible for adjusting the body, and the source of disease is the blockage of the energy stream. In fact, when we're using acupressure, we're actually working on restoring this movement of chi into the meridian. And what is acupressure? Acupressure is not a massage, but is application of pressure to acupuncture point. Acupuncture, as I mentioned before, are situated on channel or meridian containing chi of energy and through the body. Induction labor. We need to see that the clinical application for the point is that the acupressure point most commonly used for induction labor have a very strong effect on blood flow to the uterus, which is seen to help promoting cervical dilation, increment the release of prostaglandin and oxytocin. In fact, towards the end of labor, you get more like, to the end of pregnancy, sorry, you get more prostaglandin and oxytocin. Actually, using the acupressure point, they will help to increase this, and the labor will start easily. And then as well, which is very important, facilitate the production of endorphin. The endorphin helping the mother to relax and feel calm. In a way, promote pain relief as well. But more often than else, the women will feel calm and less irritable. So it's most likely labor will start. Midwifery feedback suggests notable change in her cervical wrap, and this I can say from my experience. I've been teaching this acupressure to Italian midwife, to English midwife, Malta. I've been in Malta internationally, and I always got a very good feedback that they seem to help. I'm not saying it's work all the time, but I get a very good feedback. As I mentioned before, acupressure seems to increase the chance of a woman progressing from medical induction with medical intervention. And I strongly believe that, as in medicine, this is my way of, my philosophy on pregnancy thing. We have on medicine, we have to no harm. I mean, what I try to do is best if we don't cause any problem. I mean, if we got a method that can avoid having a problem, why not to use it? Safer. The advantage of acupressure, I think, is that it's not an invasive technique, is easy to learn, and what is very important can be taught to partners as well. Especially we see after we can see the protocol, which need to be done every 2 hours using the point. That is very important. You co-involve the partner to do it, and actually you empower the couple. And then, which is very good, not only the woman as well. It is comfortable for to be safe and not painful. And this could potentially, as I mentioned before, it can reduce the need of using other form of induction like a syntocinon. Okay? And what is important as well is to reduce the cascade of intervention and reducing healthcare cost. I think in a way that the less money spent, in a way that I think will be better, sort of using more to employ more midwife, for instance, I think. I think it's interesting to compare what is being used now for a conventional method of industrial labor. What is used now is prostaglandin, which is a vaginal gel that is used for industrial labor. It works by softening and facilitating the dilatation of the cervix. It's good. Within a Cochrane review, it seemed that obviously it seemed to facilitate vaginal delivery. However, there is a risk that can cause rupture of the uterus because there is a risk of uterine hyperstimulation. And when you use oxytocin, which is the most common use as well for worldwide, it can be very useful as well to induce labor, but it can cause oxytocin, can cause very strong contraction that can reduce supply of blood and oxygen to the fetus, causing fetal distress. We've been seeing in practice, I've been a midwife in a working labor ward. A lot of the time, if you use syntocinon, end up with fetal distress. And then you have to do emergency cesarean section. And then what is very important, I think that women, by using this method of induction, syntocinon and prostaglandin, have lost very capacity, capacity of giving birth. And from some research that has been done in the past, it seemed that using acupressure seemed to empower women, and women, they seem to have a more sort of a, be more satisfied about their experience. They can be more in control of the situation. And what I think as well is very important, they don't rely on other people for their own health. And another important principle is that you need to start, when to start treatment with acupressure, you need to be started for induction 3 days before the medical intention. What I need to be clarified is that an induction can be, the most of the case, the induction can be, need to be done for post-maturity, or can be done for any medical reason, can be like preeclampsia or diabetes. However, this needs to be done 3 days the medical induction is booked. Because if you do too early, toward the end of pregnancy, progesterone and oxytocin is increasing. So if you're inducing the women too early, for instance, for social reasons, because the woman wants to be induced, you're giving like, the woman, she's not ready, basically, from the hormone point of view. She doesn't have her own syntocinon, which is the one that helps her to cope better with the pain and with the labor. So we're actually interfering with the physiological process of birth, and we are sort of might cause a problem, probably cause of medicalisation of childbirth. That is very important. Not to start induction, even with acupressure, because a woman would like to have a social induction. Okay, let's talk about the point you've been using for inducing labor. It's like a protocol, okay? You're using at the acupressure point, large intestine 4 and spleen 6. We are thinking about it they're bilateral. They need to be used every 2 hours. And you need to cover all 4 points. And then you use bladder 32 and gallbladder 21 twice a day, always bilateral, okay? However, as I see, repeat, you see the point, large intestine 4, which is here, is on the hand. Very easy to, okay? And this is a very good point for pain relief as well. Spleen 6, which is the feet, and then you use in bladder 32 and gallbladder 32. I'll go over the point. I know that I try to be, because it's nice to know the location. However, it needs to be better if we have to do practical demonstration, okay? Large intestine 4 is on the large intestine meridian. They're on the dorsal of the hand between the thumb and forefinger. You need to apply pressure 5-10 seconds. It's a pulsating pressure, okay? We do like this, pulsating, okay? Bilateral. What these points are: promote labor, tonify the chi, give energy. As I mentioned before, if you have like chi deficiency, you feel tired, the labor doesn't start because you don't have energy. It's more efficient if you use together with spleen 6. That's why, in a way, it's better if you have 2 people helping. Okay? The woman can actually use large intestine 4 on herself. When I mentioned before every 2 hours, you need to do those points, which are 4 points, every 2 hours, but not at night, because otherwise the woman will feel tired, need to sleep. Okay, let's go to see spleen 6. It's located by using forward the woman's finger with superior to the prominence of the medial malleolus. It's a very sensitive point, usually. Its sensation, if it's sharp, you are on the bone. You need not to be a sharp. You need to go by the woman's feedback. The woman will feel where the point is, because the acupressure points seem to be more sensitive from, if you compare the neighbor area, okay? You need to apply firm pressure with 4 fingers and thumb. What this spleen 6, which is a very important point for induction of labor, because it promotes cervical dilation, invigorating the circulation. The spleen meridian goes into the pelvic. So it's very good for cervical dilation, helping cervical dilation. And then you use gallbladder 21, which is here on the shoulder, on the back. It's the most tender point along pathway between C7 and tip of shoulder joint, which is called acromion, at the crest of the trapezius, so let's say bilateral. Okay. And then you've got bladder 32. Bladder 32, just to mention, is a very good point for pain relieving labor as well. It's located on the second sacrum foramen. If you are adult sensation, you want to be on the bone. what bladder 32 does, they promote an efficient labor to aid cervical dilation because they bring the energy down into the pelvis. This is an interesting case study. This was before I mentioned that using acupressure can sort of increase women's choice. In this particular case, it was a home birth. This woman avoid to be admitted to the hospital for medical induction. She was very happy because she ended up with a nice home birth. And this was my home birth. Okay, it was 36 hours prima gravida, booked for home birth. I think the hospital induction was booked for 41 plus 5. So 3 days before I went to see her, 3 days before the induction was due, because she was just to see if I could start the protocol of induction of labor. And I did a vaginal examination. The bishop score was less than 6, which indicated cervical wrapping was that she need to be help her to be induced, okay? I suggested the couple should start using acupressure to promote cervical dilation. They were very good. We did together. I made sure they were doing the point correctly. And the couple were trained, in my presence, okay? Then I left the house and I was called after 2 days as she was contracting. The contraction started. On my arrival, I used specific point to augmenting labor because the good point about acupressure, there are very good points that can sort of augmenting stimuli labor if there is a delay progressing labor. The point are spleen 6 and large intestine 4, the one that we've seen before. After 1 hour, the contraction became more regular, 3 to 4 every 10 minutes. And then I did a vaginal examination because it looked like she was in established labor. And then she was like 6 centimeters dilated, and she was doing well. The position was okay. After 4 hours, the cervix was fully dilated, and she had a spontaneous vertical delivery after 1 hour of a male infant, born in a good condition and 3 kilos. So what I want to say about this is that she, as I say, acupressure, this avoid her to be admitted to the hospital for a medical induction. And the couple obviously were very happy because they got the home birth they wanted. What are the evidence? There are some evidence which I think is nice to share with you. There's been one study, Ingram et al. 2005, which examined the effect of acupressure on the induction for women at 40-week gestation. It was a non-randomized controlled trial. The trial found that women experienced post-date pregnancy use acupressure were significantly more likely to labor spontaneously than who did not. And there was less use of oxytocin or prostaglandin, so they went into labor more spontaneously. And then there is an interesting review by Moller et al. 2015. This is like more like reported acupressure on spleen 6 and on large intestine 4 might reduce the length of labor, particularly on the first stage. As I said, not only the labor will start quicker, but it seemed to progress quicker. While, as I mentioned before, you got this point, large intestine, to tonify the energy, give home energy. And spleen 6 help to dilate the cervix. And then this is a very interesting research about spleen 6, only on this point, is the Rhinarian study, which 150 women were divided in 3 groups. One group was actually was a placebo, nothing's been done. Another group was the research that did the pressure to spleen 6. And the third group was actually the woman did the press the point herself. What is interesting about this study is that what was more effective, the women went to progress quicker in labor if they were using the point themselves, which mean because they know exactly where the point it was, and this is a very good research because in a way this suggests to midwives they need always to go by the women feedback. She will know where the point is, and it's more effective if you use the point. As I mentioned before, Chinese acupressure, which is a part of Chinese medicine, always take the emotions are very important for labor induction. In this emotion, when we're talking about mind and body is related, okay? When we're talking about emotion that can actually stagnate the the chi in the body are emotion, anger, grief, and fears. Because it tightens the inner tight on the pelvis floor and slowing down the cervical opening dilation. In fact, we're using point, liver-free and kidney one, which are the point that liver-free, the liver meridian is connected with the anger and frustration. Women, when the labor doesn't start, they are frustrated. So by actually using liver-free, we are actually helping to the emotion and release anxiety and frustration. Okay. And then another, which I noted, delay labor onset can be done because there are like certain emotion, including post-trauma. Okay, basically, if the woman had a traumatic birth before, it's most likely that was a trauma. So everything stopped. So a very good point in this situation is kidney one, is the meridian. The kidney is going to be with the fear. If the woman's fear of induction, everything will stop. Okay. Now we discuss those 2 points, which are very important for the emotion point of view. Liver-free, the liver meridian, always bilateral, on the dorsum of the foot in the hollow distal to the junction of the first and second metatarsal. So you feel like a hollow depression, as you can see from the picture. Liver meridian, as mentioned before, is important for maintaining the free circulation of chi. As well, when the chi is blocked, when you go chi stagnation, it seems that you feel the women are more irritable, you can feel depressed as well. Okay, so that is very important working on this point. Okay. Kidney one, help the woman to be in control of the situation, lose anxiety, and fear of induction. This is a very good point for pain relief as well, if the woman loses control of the situation. It's very calming, as I mentioned before. Sometimes if the woman is agitated, anxious, fear, as I said before, the labor doesn't start. I think there is a nice testimonial regarding a woman I was providing care antenatally. Basically, at 41 weeks, she tended to have, this was her second baby. The induction was booked for 41 plus 5 was booked for medical induction for post-maturity. Anyhow, I started as a protocol of 41 plus 3. Actually 3 days before the medical induction was due, and she progressed very well. Okay, they went to the hospital. They couldn't do the member suite because it was not practical. But then with the acupressure point, which I taught to the partner, they keep doing, and then she avoided to have a BME to the hospital medical induction. This is one of the things. Okay, from the point of view for safety, which is we need to be careful about not using those points, large intestine 4 and spring 6, because they are used for induction of labor. However, you can use spring 6 from 38 weeks. It's the only point you can use because it's very good for cervical, like for labor preparation, okay? But don't use large intestine 4. Gallbladder 21 is not used because it brings everything down, so it's an induction point. Spleen 1 is used for size of blood in the uterus. Don't use bladder 67 because it stimulates contraction. Bladder 67 is a good point for if the baby is in OP position, 12 well positioned, but in labor, not used before. And then bladder 67 can be used with moxa only from 34 weeks to turn a baby in breech presentation. It's a very good point. And bladder 32, better not to use. Safety, this is a very good, it's been like a Cochrane review, a Cochrane systematic review on acupuncture and acupressure for industrial labor reporting no known adverse effect on the fetus. So it's a quite safe technique. And there are research on this. So if you think some sort of a challenging that, maybe some people that doctor or your colleagues say, no, is it safe? Yes, it is safe because there is a Cochrane systematic review on this. However, it is important midwife provide acupressure, are trained and are up to date to have the knowledge of the location, the relevant acupressure point. In any case, you always have to go by the woman feedback. The pressure needs to be not too strong, and you need to have your knowledge, obviously. And obviously, you need to follow, you need to have the woman consent, you do the treatment, and you need to follow the hospital guideline. From my experience, I've been teaching in intervention in England, and there is some hospital where I taught all the staff, they got the guideline, which is very good. Because everybody will follow that guideline, which is okay. However, they need to use, as I say, you need to be sure that you are competent and safe when you offer complementary therapy. Conclusion. Yes, I think that conclusion, as I mentioned before, this holistic approach to care, more and more women now want to have more choice about induction and labor. They want to avoid medical induction if it's possible, and there is no side effect. And often it's very important, reduce the need for other form of pharmacological induction, which can have a side effect, as you mentioned before. From my point of view, acupressure for industrial labor should be an option available to women in childbirth, as it will allow them to regain some control of their best experience. They feel empowered, they know they can do something for themselves. And then, as I mentioned before, the partner can be helpful for this. Okay? The use of acupressure for both advantage to women and midwife, I think it's not only to women, but for midwife as well. Using acupressure along the midwifery profession will allow to use additional skills to support women through labor, providing continuity of care and offer constant emotional support and holistic approach. In fact, I think that the touching as well, contact of the woman, touching the woman, this is very important. She feels supported. And I believe the continuity of care as well, because you can use some point they can use for pain relief in labor. I think that from my point of view, I think that I can have more to offer to women that. And this is very important. I just want to mention a little bit about my book, which is being published in English, sorry. This is the first, Acupressure Moxibasso for Childbirth, in Italian, obviously, Digitopressione e Moxibustione per la nascita, and then it's been published in Spanish, which I'm very pleased because, you know, Spanish is the second language spoken in the world, so. Okay, let's talk a bit about the book. This book is equally dedicated not only to professional, but is for women, for everybody interested. There is a first part, about 50 pages, where I try to explain a little bit about the theory of Chinese medicine in an easy way. Okay, and then there is a lot of.
Sorry? You have about 10 minutes to wind up.
Sorry?
You have about 10 minutes to wind up.
I still have 10 minutes.
Yes, 10 minutes to wind up.
Okay, fine. I just want to, I'll be quick. Just said that the practical application in this book allow women to responsibly their home health by using traditional Chinese medicine. It is seen that to facilitate, okay, basically in the book there is some, we talk about theory of Chinese medicine, we talk about labor preparation, labor induction, we're talking about pain relieving labor and for changing position, okay, if the labor gets stuck. And then there is a whole chapter on moxibustion for turning the breech and for anemia. And what I think is very nice about this book is because there is a lot of testimonial for women that I treat and for midwives that say before I've been teaching this acupressure for the last 10 years. So I wanted to share. And it's very practical. It's like you see all the point illustration, how you use it. Okay, these are my contact details. Okay, the book is available on Amazon. If you want to sort of, as long as you type the title, okay, or you can type my name, and you can get the book in the free. Okay. Thank you for listening.
Thank you, Lordana, for that presentation. And thank you because it really enlightens people of the alternative way of childbirth. Now, one question is, we have some women who have got very prolonged labor pains, and I don't know whether acupressure would still help in their case. Do you think so?
Do you mean about prolonged labor pain?
Yes.
Yes, there is like there is few points which is seem to like tonify, for instance, large intestine 4, which he makes very more energy for in a way, because if you don't have energy, the labor is prolonged. So by using acupressure, not only you speed up the labor, obviously, but you provide pain relief. And then there is some point which is because obviously if the woman's got a very long labor, she's stressed, she's tired. So there are some point, for instance, can be kidney 1, which is very relaxing, can calm them down, and then will help. Because if you are less stressed, less anxious, obviously you progress better, quicker. Yes,
Okay.
so they're all used for that.
Okay, the other question is, you mentioned that you train nationally and internationally, and
It's
perhaps
8-hour workshop, 8-hour
yeah,
workshop.
okay, in workshops, yeah?
Yeah, I do 8-hour workshop where not only I talk about acupressure, but I talk about moxibustion as well, which I think is a very good thing for turning the breech, as I mentioned, avoid cesarean section, which, you know, is very
No,
important.
do you have any plan of rolling it out to other marginalized areas where women still are disadvantaged in terms of such kind of process?
Yeah, I think I was going to go, last year we were going to go to Bali, a conference. Yes, I think that is a good thing because in a way, it's very, as I say, is a tool that can be used for pain relief in place where, you know, there is no sort of epidural or things. Yeah, I'm planning to sort of expand the knowledge of acupressure, especially in the area where, because what is important as well, I believe in a group teaching, what you can do about teaching acupressure, doing antenatal classes. Okay, so they can be used in labor. So I really like to sort of do like a group teaching, which I've been doing for the last 10 years, but obviously I would like to, especially now that the book is written in English, I would like to go in an area where there is a need, more need in a way. Yes.
Thank you, Loredana. I don't know whether there is any other person with a question. Is there any other person with a question? Loredana, I can see
You got my email. So you got
someone
my
would
email
like to.
and things. So if you want to sort of, if you would like to organize some sort of workshop worldwide, just please contact me. I'm very happy to organize it.
Okay. Okay, thank you. Everybody, you can link up with the Loredana in the email that is given, Loredana_Zordan@hotmail.com, or you go to the website
Yeah.
www.loredanazordan.com.
Yeah, on the website, sorry, on the website, there is some video about moxibustion. It's quite interesting, like interactive video.